Hi, and welcome to our conversation around mental health in teens. My name is Dr. Georgia Bomgardner, and I am a state and nationally certified school psychologist. I'm also a licensed psychologist in the state of Pennsylvania. I've spent a lot of times in high schools, and I'm now serving as the assistant director of programs for Shanthi Project, which is a nonprofit in the area that does social emotional learning through mindfulness work in our local schools. I also have the privilege of serving on the board of the National Alliance of Mental Illness, Lehigh Valley, or NAMI. And I'm really excited to be able to share this information with you today. We're going to be talking about the different prevalence rates of mental health concerns in adolescents, some more common signs and symptoms, and how you can seek help for yourself or a friend. So we know that mental health concerns are really prevalent in teenagers and adolescents. And so that includes things like ADHD, anxiety, and behavior problems, as well as depression. And so we see that this impacts quite a lot of students. And for adolescents, depression, substance use, and suicide are really important concerns that we need to be talking about. And that's part of the reason I'm here. Among our adolescents aged 12 to 17, so students probably around your age, they were reporting that 15% of those polled experienced a major depressive episode. 36.7% had persistent feelings of sadness or hopelessness, which are aligned with symptoms of depression. Some students also reported a substance use disorder or alcohol use or illicit drug use. And 18.8% of those polled seriously considered attempting suicide, while almost 16% made a suicide plan and nearly 9% attempted suicide. 2.5% of those who made a suicide attempt required medical treatment. These numbers are staggering, and they're really highlighting the need for us to have these conversations and learn more so we can do more. But I also think it's important for us to understand what's going on in our space. So in Lehigh County, there is this really great survey that we do every 2 years called the Pennsylvania Youth Survey. And in that survey, we ask students to report on a variety of different things that are protective, like being engaged with your family and community, but also risk factors like symptoms of depression and alcohol use. And so we see in this survey that 36% of the high school students that participated indicated that they experienced symptoms of depression almost every day for 2 weeks or more in a row, to such an extent that they stopped doing some of their usual activities. And I want to be clear, this doesn't mean they were diagnosed with depression. This is a self-report. So it's their experience of those symptoms, which is obviously important, but it doesn't necessarily mean there was a diagnosis of depression. And I'm not here today to ask you to diagnose yourself, just to give you information so that you can take care of yourself and others. So about 22% of those in Lehigh County who were surveyed indicated that they seriously considered suicide, which is above that number we saw in the previous slide. And nearly 17% of those students made a suicide plan, with nearly 12% of the students attempting suicide. And those numbers, again, highlight the need for us to have these conversations and to know the warning signs and symptoms so that we can help each other. And so let's get to that. Depression is very common among adolescents, especially just the symptoms of depression. And I want to make it really clear here that we're all going to experience some of these symptoms. And just because we are experiencing them doesn't mean that we're necessarily depressed, but we may be experiencing a real low point of our mood. And remember that changes in mood are normal. They are reactions to stressful events around us. And all of us have coping strategies to work through those, but at times these symptoms may become impairing and impact the way you live your life. And so some signs you might notice either in yourself or others include appearing sad, irritable, or tearful, having changes in appetite or weight, maybe a decreased interest in the activities that you once really enjoyed. You could notice a decrease in energy, difficulty concentrating, and feelings of guilt, worthlessness, or helplessness. You might experience major changes in your sleeping habits, so sleeping less or sleeping more, potentially still feeling tired, and regular complaints of boredom. Nothing's really bringing joy. There may be talk of suicide or withdrawal from friends or after-school activities, isolation from things that maybe are supportive and helpful. And worsening school performance. You might think, okay, all of these different symptoms would certainly lead to worsening school performance. And so, fortunately, there are so many resources out there. It's just about knowing where to look and how to find them. And it's important as youth, it's really critical to start learning this information and how to take care of yourself now. And in that way, you're getting a leg up on so many others because you're starting in your youth to try to figure out what's going on and how to support yourself. And so this resource here, this infographic comes from the National Institute of Mental Health. It's a fantastic resource for you to kind of go through how maybe these symptoms might be impacting you and where you can get help. And moving into anxiety, a lot of teens also struggle with anxiety, and not just teens, the adults around you are also struggling to some extent. And just like with depression, symptoms of anxiety are things you might experience day to day based on the natural life to-dos, right? Things that are going on in your daily life. But it might include feeling nervous or on edge, even when there's not necessarily something to be nervous about. You might have unfounded or unrealistic fears, trouble separating from parents, sleep disturbance, obsessive thoughts or compulsive behaviors, or some physical symptoms like trembling, sweating, shortness of breath, stomach aches, headaches, or muscle tension are other symptoms. And it's important to recognize not only some of those more cognitive and emotional symptoms, but also those physical ones, especially around anxiety. When we're noticing those and checking in with ourselves about how we're feeling, we're going to be able to respond to it in a more responsive and less reactive type of way. And you see here at the bottom of this slide a list of some anxiety disorders. And while I have these listed here, I really want to emphasize the importance of recognizing the symptoms, because you may not be diagnosed with anxiety, but still experience some of these symptoms. And when they become impactful in your life, instead of just maybe something you can resolve quickly, that's when we really want to make sure we're reaching out and getting support. And so it's important to understand there is a difference between stress and anxiety. Stress is typically this response to something external. I've got a big test coming up. I have so much homework, right? And it's something that you can resolve by working through it. Anxiety, on the other hand, is more consistent, more pervasive. And even when that maybe stressful situation goes away, you may experience some symptoms of anxiety, even when there's really no threat to whatever is going on with you. And so there may be a kind of combo of these, right? Maybe you're experiencing stress and anxiety, and that certainly can impact you. And so it's important to recognize what's going on there and find help if you can. All of this brings us to this conversation around warning signs of suicide. And so it's important to recognize these. And these warning signs come directly from the National Alliance on Mental Illness, or NAMI, as well as the National Suicide Prevention Lifeline. And so we might see, if we're recognizing warning signs of suicide, an increased alcohol or drug use, a change in behavior that is that increase, aggressive behavior, maybe withdrawal from friends, family, and community, dramatic mood swings or impulsive or reckless behavior. And sometimes these behaviors are elevated to such an extent that there may be the need to provide support through 911 or another healthcare provider. If a student has a healthcare provider already, it would be wonderful if you're able to connect with them. And so if you're noticing that a friend or peer is collecting and saving pills or buying a weapon, they're giving away possessions or tying up loose ends, like maybe organizing papers, or if they do have them, paying off debts, right? They maybe are saying goodbye to friends and family, either right away or via writing in some way. And so if you're noticing these things, these are maybe what we'd see as more severe indicators of suicide risk. And we found that 46% of the people who do die by suicide did have a known mental health condition. Now, that doesn't mean that because there's a mental health condition, there will be these signs, but there are other reasons that someone might be at risk, and that includes having a mental health condition. So risk factors are different from warning signs. Risk factors maybe make you more likely to experience suicidal thoughts and ideation. And that includes a family history of suicide, substance use, regular intoxication, access to firearms, a serious chronic medical illness, and gender. So more women than men do attempt suicide, but men are nearly 4 times more likely to die by suicide. And it's important to note that our LGBTQ plus community youth are at higher risk of these suicidal thoughts and ideation as well. A history of trauma or abuse, prolonged stress, and a recent tragedy or loss can also be a risk factor for suicide. And if you need to talk, the National Suicide Prevention Lifeline toll-free number is listed here, 1-800-273-TALK, 8255. So that number will be changing based on the recent legislation. So be sure to look into that. This will connect your caller to a certified crisis center where that call is placed and help you work through whatever's going on, either for yourself or a peer. And so it's up to us to end the silence and the stigma around mental health. So if you think a friend might be in crisis, there are a few things you can do. Look for those warning signs and then ask how they are. Stay calm during that conversation and be respectful. Validate what they're feeling. You don't have to argue with them. Ask them how they're doing and ask if you can help them. And if they do get angry, agitated, or aggressive, which may happen in a conversation like this, you can always step away and find a trusted adult. But listen up and be sure that you're listening to them in a respectful way. Connect them with an adult as soon as possible. And I think this is the case no matter what signs you're seeing. It's often and as quickly as you can connect with that adult, the faster you're going to get that really supportive care. Maybe your friend has an adult that they would prefer to talk to, but they might not want to talk to an adult. So you may need to explain why it's important that they do find that support. If they refuse, it may be up to you to ask an adult without your friend's consent. Remember, you're saying something in order to support and care for your friend, and their life and health is the most important. Your friendship is also important, and although it may feel like this type of support can damage that relationship, know again that that life of your friend, of yourself, is the most important. But never place yourself in danger and do not take on more than you can handle. There are people in this community that are trained and able to support people in mental health crises. You do not have to be a mental health clinician in this case. Sometimes it can be hard, though, to talk to a trusted adult about mental health, and there are going to be common concerns. You see these on the left here. I don't know how they'll react. They'll be sad or disappointed. They won't take me seriously. They'll ask too many questions. Maybe you don't want to burden them, or they're part of why you're struggling, or you don't think they'll believe you. And my tips for you are to find that trusted adult that you do feel will care about you, and the sooner you can talk to them, the better. If you have information or data to present to them, what you're experiencing, what your symptoms have been, how it's impacted you, how long it's been going on, that's going to be very helpful and help them understand what's going on with you, because they can't be in your head. Remember, that person that you've gone to is someone who cares about you. Because they care about you, they are not going to want to see you suffer, and they may react with some defensiveness, be kind of angry. Oh, well, you shouldn't feel like this. Everything's okay. You'll snap out of it, right? I know that's not a helpful response, and sometimes that is the way people respond when they do care, because they're just not comfortable with seeing struggle, right? So try to be honest and open and talk to them as early as possible. So we've covered a lot today, and there's so many resources available to you that I want you to have here. I included information from the National Institute on Mental Health, NAMI, Lehigh Valley, the Center for Disease Control, Youth Mental Health First Aid, and of course, Lifeline, the Suicide Prevention Hotline. That number is available for you there, but you can also text 741-741. And if you scan this QR code on the right, you will find resources available to you, those that are listed here, as well as suicide prevention hotline numbers for our area. I thank you for letting me be here today. I hope this was some helpful information. And remember, it really is up to us to break the stigma, to have these conversations, to recognize that others around us are also struggling. We can be those models that say, you know what, it's okay to speak up, it's okay to reach out, and it's okay to seek help. You would do it if you were needing support academically or maybe in a sport, and you should be doing it for your mental, your social, your emotional health as well.